Okay, go ahead.
Okay, so we read chapter 5 of McCoy and Keene, and it was about child neglect. So child neglect is defined, or child abuse and child neglect are defined together by the federal government as any recent act or failure to act on the part of a parent or caretaker which results in death, serious injury, or emotional harm, sexual abuse or exploitation, or an act or failure to act which presents imminent risk of serious harm. So neglect is essentially the failure to meet the minimum requirements for care. And it's important to distinguish between the failure to meet the minimal requirements for care and the failure to provide ideal care. As you can see, the definition is pretty broad and it doesn't really define what actually constitutes neglect. And further, each state has its own definition of neglect. So this is challenging for people who work in child protective services because it provides kind of a gray area. Across the board, though, neglect is considered to be the failure of parents or caregivers to meet a child's need for food, shelter, clothing, protection, and medical care. Next slide. So there are 6 different types of child neglect, which include physical neglect, emotional neglect, medical neglect, mental health neglect, educational neglect, and abandonment. Physical neglect is the type of situation that's most commonly associated with the term neglect, and it is the failure to meet the minimal physical needs of the child, which include food, shelter, clothing, and protection from harm or danger. So naturally, there's a lot of debate over what constitutes the minimum level of acceptable care and what would be considered maltreatment. Because there's kind of a continuum where there's families that have children who are malnourished, which would clearly be considered neglect. But then there's also families that feed their children 3 meals a day, but the meals consist of food with very little nutritional value. So like I said, there's kind of a gray area for what actually constitutes acceptable care. There are a few components that are considered when determining whether neglect is present. Because accidents happen, there's always instances where parents won't be able to provide optimal care. So with neglect, there often needs to be evidence that a child's needs are not being met on a consistent basis. So one way that this is measured is through determining whether the child is maintaining normal growth, like their height, weight, just that they're relatively healthy. Another component is appropriate shelter, which is another challenging thing to define because the law just states that parents must provide a suitable place for their child to live, but it doesn't specify what that means. So it's considered on a case-by-case basis by the caseworkers. And then lastly, the law says that there should be adequate supervision to protect the child from harm. So this requires being present, attentive, and providing a safe atmosphere for the child. And again, because that is a pretty broad definition, caseworkers consider the age, developmental level, and immediate circumstances of the child and determine neglect on a case-by-case basis. So because each incidence is unique, it's difficult to determine what constitutes neglect, but there are 10 potential indicators. As you can see, they kind of have to do with providing proper hygiene and a safe place for the child to live. But there are items on this list that every family has experienced, like number 10, spoiled food in the refrigerator or cupboards. And so that's why neglect is looked at as a pattern of behavior and not just a one-time instance. And then further, as I've said before, a lot of the items on this list are open to interpretation by the caseworker. The law is really broad, so what one caseworker might consider as an unacceptable living condition might be different than another. So in instances of suspected neglect, a caseworker will assess the situation and bring the case before the court, and then the judge will determine on a case-by-case basis if the child's needs are being met. that.
So another type of neglect is emotional neglect, which is the failure to meet a child's emotional needs. And this form of neglect is difficult to define and prove because of the question of how much emotional attention is enough for each child. So this type of neglect is rarely the only reason for maltreatment. It's usually paired with another form of maltreatment, such as physical neglect or medical or mental health neglect. Next. The next form of neglect is medical neglect, which is the failure to seek medical treatment or to provide treatment that has been prescribed. And this type of neglect is very sensitive to different religious beliefs because within some religions it's prohibited to have blood transfusions or organ donations. So even though it may be beneficial to the child, parents are against these procedures because it's against their religion. And older children are more able to speak for themselves. Obviously, if they're of sound mind, they can make decisions for themselves. But if they're still minor and their family is completely against the operation, then they can't go through with it. And another type of medical neglect is just the delay in seeking treatment. So, for example, if a child is riding his bike and he falls and he hits his head and it's gushing blood and the parent waits to get treatment, then that's a form of medical neglect because you're waiting too long. And the next type is mental health neglect, which is the failure to seek help for a child's severe psychological problems or to comply with recommended therapeutic procedures. So it's very similar to medical neglect, just in the form of mental health, and it's just an unacceptable delay in seeking or providing treatment when a reasonable person would have realized treatment was necessary. So, for example, if a child is suicidal and it becomes known to the parent and the parent doesn't seek help for their child, then that's a form of mental health neglect. And there are two criteria to make a diagnosis, which is a team of 2 or more appropriately accredited mental health professionals must conclude that the child has a serious emotional or behavioral problem, and the child's caregiver refuses to provide or maintain the suggested treatment. So it's not just providing the treatment, it's keeping it up. So if the child needs to go to therapy every week and the parent doesn't want to take them anymore, then that's a form of mental health neglect as well. And the next one is educational neglect, which is the failure to meet legal requirements for school enrollment or attendance or the lack of attention to special education needs. And this is the easiest to document because schools are very good about keeping attendance records. And the National Incident Study 4 says that educational neglect is permitted chronic truancy, which is when the student is absent on average 5 days per month after the parent has been notified and has not done anything about the situation. It's also failure to enroll / other truancy, which is the parent allows a child to miss at least 1 month of school or keeps them at home for inappropriate reasons. So reasons could be that they need them at home to take care of the other kids and whatnot. And it's also inattention to special education needs. So if the parent is notified that their child has special education needs and just refuses to get them for them, then that's a form of educational neglect. And the last one is abandonment, which is desertion, severing ties with and failing to support one's own child. And this can be in the form of leaving a newborn child or kicking minors out of the house. And with abandonment, there are these safe haven laws that vary from state to state, which allows parents to leave children at designated locations, which could be like a hospital or a fire station. But the problem is that a lot of mothers are unaware of this law because it varies from state to state, and so they go and leave their child someplace and then are charged with abandonment when they could have been protected under a safe haven law.
Okay, so now I'm going to talk about some of the consequences of neglect. Normally it depends on numerous factors: the severity and the duration of the neglect, and then the age and developmental level at the time of neglect of the child. So first off, there aren't always negative consequences. Sometimes children just they're not positive, but they tend to be resilient at times. Not as common, but these children tend to leave with minimal negative effects. It's usually children who are capable for caring for themselves, so they're able to feed themselves and bathe themselves. And so these kids are less likely to be seriously impacted by the neglect. Usually it's going to be older kids who are capable of taking care of themselves. So starting with infants, these guys are usually the most severely affected. As far as infants, they can be diagnosed with non-organic failure to thrive, which is when infants who were once in the normal range fall below the 5th percentile for height and weight with the absence of any organic explanation. So these infants it's usually due to malnourishment, either intentionally on the part of the parents or it's a result of parental inexperience. So whether the infant is not getting fed enough during the day, or the parent just doesn't want to spend their money on food for the infant. Poor attachment is a consequence for infants. Their relationship with parents usually lack physical contact. They have no separation anxiety, and there's often no pleasure upon reunion. These infants, as they get older, usually are going to be forming unsatisfying relationships for the rest of their lives. Usually the first real relationship between an infant and the parent will determine how their future relationships are. And then some physical consequences: poor muscle tone, rashes and infections. So, moving on to childhood, the consequences in childhood can be language delays, so the development of the children usually is not up to where it needs to be. They do not learn to listen and comprehend complex sentences, usually if they're told too many things at once. So, for example, if a child is in class and the teacher lists several things: go hang up your backpack, hang up your coat, go turn your homework in, sharpen your pencil, etc., that ends up with an overwhelmingness feeling for the child. This is usually due to the fact that they engage very little in conversation with their parents and they don't get paid attention to. These children are usually more familiar with short commands like shut up or go away. So their language is not getting the proper attention it needs to develop. Intellectual and academic problems is another consequence. These children have documented cognitive deficits and underachieve academically. Possible explanations for this is that they are less persistent and enthusiastic due to inadequate parenting, likely due to neglectful parents not helping their children develop persistence by encouraging their efforts. Non-neglectful parents usually encourage their children's efforts even when they are not perfect. So these children who are being neglected aren't getting any sort of encouragement, usually just negative attention. They have poor school attendance. So the average absences for neglected children per year is 21 days, and then for other children who are not neglected, they usually miss about 5 days. So they're missing quite a bit of school. And then impaired socialization is a third consequence for children. They tend to be passive socially and are less likely to display affection or initiate playful interactions. They're usually neglected by their own peers. So this can usually be due to their language delays. They have a hard time communicating with the other children. They lack the skills to approach peers and engage them in play. They did not learn how to from loving, attentive parents, so they never had that shown to them or taught to them. And then low self-esteem, which usually prevents them from seeking attention from others. And then they tend to be rejected by their peers as well. They tend to be more aggressive, possibly due to needing to do whatever they can to get their parents' attention. They engage in a high number of positive and negative attention-seeking behaviors at school. So the child who is constantly acting out or misbehaving or trying to always raising their hand in class, they're wanting the teacher's attention, and this usually ends up being negative towards their socialization. And then physically neglected children are usually unappealing to other kids because they aren't dressed well, they have bad hygiene, and they appear dirty. So now going into consequences of neglect in adolescence, these children who are neglected as adolescents often have a long history of being neglected. So impairments from infancy when they were neglected just tends to continue on into adolescence. Usually they can be runaways, so they often end up engaged in crime or as victims of crime. They're socially isolated, as talked about with neglects for children, so this just continues on into their adolescence. They have poor social skills, which continue to inhabit them, and they have a hard time keeping their friends. There's also intellectual and academic problems still. So they have a higher rate of school expulsion and dropout, and they have lower achieving scores. Delinquency, there's a positive correlation between neglect and later criminal conduct. So this could be due to their lower IQ scores. And then they're more prone to psychiatric disorders, and they're more likely to attempt suicide. In the end, the consequences of child neglect can negatively affect a child for the rest of their life. Being the victim of child neglect increases the chances that a child will suffer social, emotional, and cognitive deficits that persist throughout his or her lifetime. The end. Okay.
Yay!
Yay!
Which person do you want me to click on for yours?
Nadia.
Okay.
Okay, we good to go? All right, thanks for sharing, guys. We'll move on to talking about Chapter 6 in the same book by McCoy and Keene. Chapter 6 focuses on psychological maltreatment. So before we get into the details of psychological maltreatment, I'll go over the definitions that are needed to know, I guess, in order to understand it a little bit better. So when it comes down to it, psychological maltreatment is actually pretty difficult to define. There's no uniform definition. This is because the research is new, and it wasn't even considered as a form of abuse or neglect or even maltreatment until the 1980s. So, so since the 1980s, psychologists and other researchers have found that maltreatment is made up of psychological abuse and psychological neglect. So psychological abuse covers behaviors that harm the child's mental health. So these can be parental behaviors or behaviors that are caregivers or even teachers. Psychological neglect is defined as failing to meet the emotional needs of a child. So you can see that there's a little bit of a difference there. A big issue that comes about when trying to define psychological maltreatment is using emotional and psychological interchangeably, because emotional is used to talk about feelings, whereas psychological pertains to cognitive skills and pertains to the mind. So, so it's tricky when they're used interchangeably. However, in this book, the authors do outline that they will be using emotional and psychological interchangeably. When it comes to legal definitions, emotional abuse is mentioned in all in statutes of all states except for two, and those two states being Georgia and Washington State. The definitions that are mentioned in those statutes are generally based on child outcomes. And however, then psychological neglect is less well covered than psychological abuse. However, those statutes are still not perfectly clear as to what behaviors constitute psychological maltreatment, no matter the amount of detail that has been put in to those statutes. So there's also psychological definitions. So in the DSM-4, they don't have a code for psychological maltreatment, but the closest code relates to the parent-child relational problems, which basically talks about the significant impairment in the interaction between parent and child, and if that has an impact on family functioning. So the reason that there's been such an issue with defining psychological maltreatment, again, is researchers have had a hard time figuring out what psychological means. So you have to look at the Parents Act and the child outcome. And so for that, we'll go ahead and show you a table in just a moment. I thought I had it on here. There we go. So here we can see the conceptualization of psychological maltreatment. This is a table that was created by McGee and Wolf. So you're looking at the physical child outcome and psychological child outcome, and then you're looking at the acts of the parents. So if it's a physical parental act or psychological parental act. So you can see if there's a physical parental act, such as hitting, and there's a physical child outcome, such as bruising, then that's considered a child physical abuse case. If you're looking at a physical parental act, so such as the parent consistently hits the child or somehow hurts them in a physical manner, but there's a psychological child outcome, such as depression, it's not necessarily considered psychological maltreatment. There's no definition per se as to what that is. However, if it's a psychological parental act, no matter the child outcome, it's considered a psychological maltreatment case. So this again could be if the parent consistently emotionally abuses the child by calling them stupid or telling them they're not good enough, and there's a physical child outcome of that by maybe through cutting or through hitting themselves, that's still considered a psychological maltreatment and not necessarily a psychological maltreatment case, and not necessarily anything else out of that. We'll go back to, so, oh boy, sorry guys. Whoa. Okay, we good. Sorry. So, lastly, regardless of parental intention, so if they're deliberately ignoring the child or being ignorant or intending to harm the child with harsh words, a form of maltreatment has occurred. A form of psychological maltreatment has occurred. So even though the legal and the psychological definitions are still a little bit shaky, they're still trying to find a more clear way to explain it. And Kelley can actually provide a little bit more clarity on that front.
So for my section, I have a lot of information that I'm going to present. So I'm going to kind of lay it out there and go through some of the different types and the codes within psychological maltreatment somewhat quickly, just because there is so much and there's many different ways of looking at it from different perspectives. So for the first one, is from a society called the American Professional Society on the Abuse of Children, and they've condensed that into calling it APSAC. And APSAC has created a sort of type, or I guess mannerism, for categorizing the different types of psychological maltreatment. And they are probably the most commonly used definition and types that people discuss. So I will show you, let me show you a little screen share here. So here, under APSAC's definition, they have 6 different subtypes. So the first one is, they can call it spurning. And spurning is caregiver behaviors that are hostile toward and or rejecting of a child. So some examples of those is belittling, degrading, shaming, ridiculing, publicly humiliating a child, or using them as a scapegoat. And those can be either verbal or nonverbal. The next one is terrorizing. So a caregiver who threatens a child, threatens their loved ones, threatening their possessions, and a common form that you see of that is maybe threatening even a stuffed animal, or more commonly threatening a pet and threatening it with violence, or even just merely placing a child in a dangerous, unpredictable, or chaotic situation. The next one is isolating, which is pretty self-explanatory. It's confining a child within a space and not giving them opportunities that are appropriate for their age group to socialize. The fourth is exploiting and corrupting a child, so parents who encourage children to develop inappropriate behaviors, such as modeling or encouraging negative behaviors. And one form that the text talked about is parents who encourage their child to participate in criminal acts, so parents who encourage their child to steal for the benefit of their family because they can't afford something, or something of that manner, or merely restricting or interfering with the child's cognitive development and not allowing them proper opportunities to develop in that way. The second to last one is denying emotional responsiveness, and this is merely parents who are disconnected with their child. They ignore their child, they have no emotional reactions to their child, they have very infrequent interactions, and they show no affection toward their child, and that can be really damaging to a child's ego and sense of self-worth. And then finally, the last one is the mental health, medical, and educational neglect, which constitutes as parents who ignore their child's needs in those areas, such as mental health, medical, and education, and don't provide opportunities for their child in those areas. So that is really one set of, I guess, typing or subtypes. The next one is a woman with the last name Glasser, and she argues that APSAC's definition has no theoretical basis. So she proposed an alternative understanding that's really based on the child's needs and a framework that surrounds that. So within her, she acknowledges 5 different subtypes based on the child's needs. The first one is emotional unavailability, unresponsiveness, and neglect. So parents or caregivers who are physically unavailable or even emotionally, psychologically unavailable for their child. And the text talked about how it can range as bad as parents who are drug addicts to merely those who we commonly see who have really demanding jobs and just don't necessarily have time. The next one is negative attributions and misattributions to a child. So caregivers who are hostile toward their child and they have very rejecting tendencies toward their child. An example of this that the text talked about is a child who brings a flower home for their mother. And the text talks about how there can be positive, neutral, and negative attributions. So a positive attribution made for this is the mother would say, "Oh my gosh, my child is such a sweetheart. They obviously love me, so they brought me a flower." Thinking very positive about it. A neutral attribution of this would be, "My child saw this flower on their way home and they brought it home for me." That's just kind of, doesn't go one way or the other. And then negative attributions, which is what the text is talking about in terms of psychological maltreatment, is a mother thinking So my child brought me this flower home. They must have done something bad, and they're trying to distract me by bringing me this flower, yada, yada, yada. So having that negative outlook on their own child and thinking that their child is driven by negative things and that they deserve punishment or even rejection. The third one is developmentally inappropriate or inconsistent interactions with a child. And you see this with parents who expose their children to age-inappropriate situations, who don't know what behavior is appropriate for children at certain ages. And the example that they gave is a mother tells her toddler, her 2 to 3-year-old, that he or she can go out to play as long as they come back in 15 minutes. And then, of course, the child is 2 to 3 years old and does not know what 15 minutes is, so does not come back in at 15 minutes, and the mother punishes the child. And that's just, I mean, it's crazy to think that a child of that age not only knows how to tell when 15 minutes is, but is able to sense it without a watch or what have you. So that's an example of one of those inappropriate expectations for their child. The fourth one is the failure to recognize or acknowledge the child's individuality and boundaries. So using a child to fulfill their own needs, and this is seen a lot in families where children are used as weapons in difficult divorce situations, and where a parent will use a child to exploit a child to fulfill their own needs in that sense. And then finally, the last one is failing to promote the child's social adaptation, so deliberately mis-socializing a child and not giving them those age-appropriate experiences that they need at that age. And then the text also talks about really needing to look at parent behavior and looking at it on a continuum, a line of a continuum. And they talk about how there's healthy parenting, dysfunctional parenting, and maltreating parenting. And you can see on the PowerPoint that healthy parenting is what we typically see. Rules are appropriate, rules are clear, they're explained to the child. Dysfunctional parenting might have rules that are unclear or inconsistent, but they still are appropriate for the child. And then maltreating parenting are parents who have arbitrary rules. They might exploit the child for the parent's benefit, and really there's no rhyme or reason to the parenting techniques. They also talk about how we must take into account parental intent and the degree of harm that's associated with the maltreatment. So the text says that if intent and harm are both present, it's obviously severe maltreatment. If only intent or only harm, so one or the other are present, then it's moderate maltreatment. And this is one I don't necessarily understand, because it says that if no intent and no harm are present, then it's considered mild maltreatment. And in my opinion, I would think that would just be no maltreatment, because they don't intend to hurt anyone and no one gets hurt. I don't know. And it talks about how the above presumes that you can actually measure intent and harm, which is often difficult. So this last section I'm going to go through pretty quickly because the text doesn't really elaborate on it much, and they're very self-descriptive. So the NIS National Incident Study describes 8 codes for emotional abuse and 11 codes for emotional neglect. So the 8 codes of emotional abuse are described as close confinement, tying or binding, close confinement other. There were no specifications for what that is, so I'm not necessarily sure what that would mean. Verbal assaults and emotional abuse, threats of sexual abuse without contact, threats of other maltreatment, so that could be, I don't know, threatening to hurt a child, terrorizing a child, administering other unprescribed substances, or other or unknown abuse. So that could be maybe parents who are overly punitive or emotionally abusive in ways that aren't necessarily covered in the other areas. Then the 11 codes for emotional neglect are inadequate nurturance or affection, so caregivers who don't sufficiently nurture their child, knowingly permitting drug or alcohol abuse. Another one that I think I didn't put in there is domestic violence, and this one's interesting because the negative behavior in that situation is directed at the other adult, but research shows that the presence of violence is detrimental to a child's well-being. Another one is knowingly permitting other maladaptive behavior aside from drug or alcohol abuse, so maybe encouraging unprotected or underage sex or something of that nature. Refusing to allow or giving needed care for diagnosed emotional or behavioral impairment. So if a professional says the child needs care in this area or the next one is just by another professional and the parent ignores that or doesn't get care for their child, then that's where there's issues of that. The seventh one is overprotectiveness. The next one, providing inadequate structures, so maybe their living space. Second to last one is the exposure to maladaptive behaviors in the environment, so that could be even doing drugs in front of the child or acting inappropriately. And then the last one is other inattention to development or emotional needs. So that they just described it as any general inattention to child's needs that are not covered in the above categories. And Tiffany's going to take it away from here. Hold on, let me turn my screen sharing off. Okay.
Okay. Do we have the slides for the last ones?
Oh, yeah.
Okay. So as far as the consequences of psychological maltreatment, there are 5 areas of concern. And the first one is interpersonal thoughts, feelings, and behavior. And research has found that children that have gone under psychological maltreatment have low self-esteem, and they created negative life reviews, and they're more likely to suffer from depression and anxiety, and they're more likely to have suicidal thoughts and behaviors. The second area of concern is emotional problems. So children who have suffered psychological maltreatment are emotionally unstable. They have poor impulse control. They often end up going through substance abuse in their later years. They're unresponsive. They can suffer borderline personality disorder as well as eating disorders. They also have a lower satisfaction with their lives, and they have unrealistic views of children. So it's often found that if children grow up under psychological maltreatment, they will often make a cycle of it and put their children kind of through similar situations. The third area of concern is social and antisocial functioning. So these children tend to have attachment problems due to not having the nurturing, safe relationship with a caregiver in their earlier years. And this often leads to poor social competence, aggression, violence, and they're socially hesitant and tend to cling to adults. The third area of concern is learning problems. So they just struggle overall in school. Their mental competency and academic and intellectual problems. They show lower test scores in all areas, and there's often delays in development. And 21% of victims are often kept out of school by parents, and this is due usually just to proper schooling just isn't arranged, and or just left at home. The last area of concern is physical health. And so children can often develop allergies, asthma, respiratory problems, hypertension. In the spurning victims, there's more somatic complaints, and there's increased risk for mortality. And also there has been shown to be non-organic failure to thrive in infants. And as these victims become older, they tend to self-harm themselves in most common ways of cutting, hair pulling, hitting, or ingesting toxins. They also show a self-critical thinking or pattern of thinking. So in conclusion of psychological maltreatment, we just need to keep in mind that parent and child relationships are not all black and white, and there's just many other external factors that have an impact on them. The research on psychological maltreatment is in its very early years, it's still something kind of new. The psychological maltreatment, it does have a high incident rate. It is extremely difficult to prove, but it is associated with significant negative developmental outcomes across the board. So cases are underreported to CPS, sadly, and many people know that physical harm is not okay, but they fail to realize words can actually be equally as damaging to children. And that is all for our presentation.
Yay!
Hey!
Woo!
Bye-bye!
Bye.
Bye.